The Democrats shut down the government because President Trump and the Republicans will not force American taxpayers to pay for free health care for illegal aliens. America is $37 trillion in debt. We cannot afford to provide taxpayer-funded free health care to illegals who broke the law to enter our country.
Hello, I'm Dr. Haydée Brown.
And I'm Dr. Sonya Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond. So, Carolyn Leavitt, right? The press secretary speaks from the White House on the reason why the government shut down this week. And with a lot of arrogant finger pointing, she mentions the cost of medically taking care of people who actually do need it, you guys. But she didn't mention anything about the new $24 million gold ballrooms that Trump is building in the White House, right? And that is by reports that we hear right now that construction is still going on in that ballroom, even though there is a government shutdown. So she says, if you're taking care of illegal immigrants, it's costing America too much. Medical care that we by physicians have to give by the EMTALA law. But she speaks nothing, you guys, of releasing Epstein files with potential government pedophiles who have caused extensive harm to innocent young girls and boys worldwide. She blames the Democrats, yet the Republicans have refused to come to the table and even discuss a sensible bipartisan resolution at this point. So when the government shuts down, the effects on healthcare are not just sort of happening, it is immediate. This is now a major, major issue in our world, healthcare. Because emergency rooms, yeah, they may remain open and Medicare and Medicaid may still get their processes claimed, but the systems that are going to get hit basically are the programs that the hospitals have, clinics, and definitely research. You know that's going to happen. So funding streams to rural hospitals that we're already seeing close, children's health programs, and specifically community clinics will begin to stall and probably shut down. The Children's Health Insurance Program, is CHIPS, the safety net for the hospital funds, they're going to be facing some gaps, if not dead stops. So that means facilities that are serving the most vulnerable, and who is that? Minorities, you guessed it. Those are going to have payment delays, staff shortages, firings, and definitely closures. So it doesn't stop there. You guys know that. We've already seen it with the CDC and the NIH. Our nation's backbone to scientific research is now going to be forced to stop again, to pause their research, suspend these clinical trials, and delay grant approvals once again. For what? Because patients that are waiting on life-saving therapies by this research are now going to be stalled because we have a shutdown. It's not about paperwork. This is personal. This is life and death. So the regulatory oversight, things like drug manufacturing checks, hospital compliance, safety inspections, gone. Those are going to cause public health risk. But we're not even talking about who's really going to be devastated. People like young mothers, young children that need the WIC program, those are going to be more likely to be cut off sooner than later. Probably the first things they're going to cut off. And that ripple effect is going to hit the communities the hardest that are already struggling, you guys. So when we talk about government shutdown, it's not just about politics. We're talking about real people, real families, real health issues and outcomes. A shutdown destabilizes the safety nets designed to protect us all. And that is the cost that we're dealing with. And Dr. Brown, the other cost, the real cost that Americans have when it comes to this administration who has done everything to say they're going to make America healthy again, but they have done everything else they've wanted to. So now why this shutdown and why are they blaming the Democrats? Let's roll this clip.
Democrats, the party of open borders, transgender for everybody, lawlessness in our streets, are shutting down the government in an effort to appease the radical left. These Democrats are coordinating their strategy with outside leftist groups and are demanding nearly $1.5 trillion in spending for an agenda that includes healthcare for illegal aliens and much, much more. Democrats for years have railed against government shutdowns, claiming a shutdown would mean much chaos and pain and needless heartache for the American people. Democrats are out of control, and you know who it hurts?
You, everyday people, and the most vulnerable. Seniors, veterans, working families, hungry kids, y'all.
Tell Congress to avoid the Democrat-led government shutdown.
On the webpage of the White House, a few quick notes. The GOP controls the executive branch and both legislative branches, so the Democrats do not decide on this shutdown. Also, that illegal immigrants do not get free health care. It's actually against the law. Anyways, so this White House, it's just such a problem. When we look at the current Republican budget proposals, the numbers look and speak loudly. Over the next decade, they call for more than $1.1 trillion in cuts to Medicaid and the Affordable Care Act marketplace programs. That means millions of people, low-income families, children, and people with disabilities could lose coverage, and analysts estimate as many as 10 million Americans could be affected. Medicare isn't untouched either, right? Proposed changes could trim benefits, reduce reimbursements, and shift costs to seniors. For older adults living on fixed incomes, that's not a small adjustment. It's a direct hit to their healthcare security. And then there's the Affordable Care Act. Right now, enhanced premium tax credits are keeping plans affordable. Without them, the average yearly premium, currently about $888 after subsidy, would more than double, jumping to $1,904. And for a middle-class family, that's not a rounding error. That's rent, that's mortgage, that's groceries. And according to the Congressional Budget Office, as many as 4 million people, 4 million, could lose marketplace coverage if those credits expire. We should also note that this is the second government shutdown in recent history. The first occurred during Donald Trump's first term, when political brinkmanship left federal workers without paychecks and vital programs in limbo for over 30 days. And so today's shutdown, it just reflects another step in this broader policy blueprint. The Heritage Foundation's Project 2025, along with figures like the CBO director, Russell Vought, who's the architect of Project 2025, they've outlined an approach for reshaping government by reducing the federal role in healthcare and social programs. So the current proposals align closely with that vision. It's all about Project 2025. So these aren't just budget lines on a page. These are real families, real seniors, real patients who will feel the impact in their wallets and in their health. Cuts of this scale mean higher premiums, fewer benefits, and in many cases, no health coverage at all. And we're piggybacking that on certain rural communities that already have very, very sparse healthcare. So that's the reality of what's at stake. Let's just go to the next clip.
So let me make one final point. I think a lot of Americans are asking themselves, why did this happen? Why did the Democrats shut down the government despite, as Caroline said, voting on the exact same piece of legislation 6 months ago? And there are a lot of different spins that we can put on it, a lot of different answers that we could give, all of them true. One answer I already gave is that they want to give health care benefits to illegal aliens. That is true. They gave us legislative text that would have undone us cutting off health care benefits for illegal aliens. That's one of the things that they asked for. But the reality here, and let's be honest about the politics, is that Chuck Schumer is terrified she's going to get a primary challenge from Alexandria Ocasio-Cortez. The reason why the American people's government is shut down is because Chuck Schumer is listening to the far left radicals in his own party because he's terrified of a primary challenge. So I'd invite Chuck Schumer to join the moderate Democrats and 52 Senate Republicans, do the right thing, open up the people's government, and then let's fix healthcare policy for the American people.
Dr. Brown, the fact that all of these crazy videos are actually on the White House website. So J.D. Vance is speaking and again, finger pointing and now bringing in other people to blame. I mean, again, this is the ultimate of gaslighting, right? Throw it, flip it to someone else being the fault. But actually there is something called the Hatch Act. And I'm sure you guys have heard some of this. It sounds like just another piece of Washington red tape, but its purpose is very clear. It protects the line between governing and campaigning, or in this case, bullying. Since 1939, the law was said that federal officials cannot use their position, their time, or government resources like web pages to influence partisan politics. And so that makes this GOP and all the other GOP videos very, very concerning because they're not following the law once again. The individuals speaking out are not private citizens. They're sharing their views. These people are government officials. They are paid by taxpayers, appearing on behalf of their party in official capacity, no less. So are they explaining policy? Not really, but that would be allowed. Are they actually educating the public on programs? That is actually their damn job. So Dr. Brown, I don't know if you saw the webpage even now for HHS. The webpage is up, and on there, there's on a blurb, and on most of the government pages says, mission critical activities of HHS will continue during the Democratic-led government shutdown. Please use the site as a resource as the Trump administration works to reopen the government for the American people. If that is not finger pointing, my God, it's like we're kids here, you know?
Yeah, and this website, it remains up and it's usable. But when the language on official government platforms moves beyond explanation into persuasion or even unfounded derogatory statements, telling the public that they should or should not support, or who they should or should not support politically, that crosses the Hatch Act territory, right? This law was written to prevent exactly that, using the weight of government authority to tilt the political field. So since January 20th, 2025, we have witnessed a rapid erosion of our constitutional norms and balances amongst the three branches of government. Now, Project 2025 has barreled forward, reshaping institutions in ways that align with that blueprint. And while Donald Trump has publicly denied knowing about this plan, the denial runs counter to the facts. It's also profoundly damaging to his own base because the policies that Project 2025 is advancing strip away protections, increase costs, and weaken healthcare for the very people who supported the current administration strongly. And, history reminds us that President Nixon was impeached and ultimately resigned for abusing government power to punish his adversaries. And here we are again with official government websites falsely accusing the opposition party of causing this shutdown. That's not just political messaging. It's a misuse of public trust, echoing the very abuses the Hatch Act was designed to prevent. So these aren't just technical violations. They are real warnings to the American people that institutions meant to serve us are being turned into partisan tools. And when you connect this misuse of government authority with the very real budget proposals that we just discussed, with those cuts to Medicare, Medicaid, and the Affordable Care Act, it becomes clear that Project 2025 is not theoretical. It's already shaping both the structure of our government and the daily lives of millions of Americans. And that is the reality of what's at stake.
This is a hard time in America right now. So take care of yourself. We want you guys to stay informed and stay vigilant. But remember, truth is the most powerful tool. And so places like MeidasTouch Network, their YouTube, their website, as well as their Substack are where you're going to get the information. So please like, subscribe, share, and follow for more, because we are contributors to MeidasTouch Network and proud members of the Meidas Mighty. Have a great week.
Thank you, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.